He is. He's probably taking some urgent call. Do you need a sound check?
Audio, name and role.
Okay. Jill Ludford, Chief Executive of the Murrumbidgee Local Health District.
All right, Jill. So last time we saw you, the lockdown was preparation. Now we're thrust into lockdown in regional areas. Can you just give us a bit of an overview of what that means for us?
Okay, so yes, as of Saturday afternoon, we all right across our region moved into stay-at-home orders, which came as a bit of a surprise to many, but when you think about what was happening all around us, it was really to be expected. And look, this is a very difficult time. Clearly this morning we've seen increasing risk all around us to the north, east and west, with increasing numbers. So I think it's really, really important that we encourage people to stay at home. It's the best thing that we can do now. It gives an opportunity to arrest the community transmission of any COVID virus that's in a community, and also gives our contact tracers an opportunity to catch up on some of the contact tracing. What I'd really like to do is just to talk to you about what changes we've had to make in our hospitals associated with those changed orders that we're all living under at the moment. So to start off with, just encouraging people to stay at home, only go out if you need to get groceries or essential household items. Just the rural context, the orders do talk about a 5 kilometre zone, but there are people who are watching this today who live on farms and properties, so it is understandable that you will be reasonable and go to your closest supermarket. But we live in a rural area across a wide diversity of geography. Also, people are working from home. There's virtually no one in my office today, but obviously our staff are at work. They're all essential workers, and we have people return to homeschooling unless that's practicable. So it's very difficult times for everybody, and I really encourage people to look after each other during this time. Now, our hospitals. So emergency departments are very importantly open for everybody to come if they are urgently ill. Encourage people to ring 000 if they require urgent assistance. If you do have a respiratory symptom, though, we'd really like you please to call ahead to your emergency department or hospital just to give us the heads up if you have any respiratory symptoms, so we can make sure we manage you through that appropriate COVID pathway. Other changes that we've made is around visitation, and it's always difficult, and we appreciate this has a big impact on patients and families. So I'll just go through though to make it clear. So we have restricted visitors, people who are socially visiting or pastorally visiting, but we will allow visitors in particular areas. So particularly for women having babies, obviously they need to have their support person. That's fine. Also for children who need to have parents or guardians, that's fine. And also for carers. We know that there are a number of patients and in residential aged care facilities or people with disability where carers are actually supporting and participating in care for patients. So once again, the local facility manager will work to risk assess those particular people and make sure that they can continue to come into our facilities. Everybody coming in has to meet the screening criteria. So if anybody's been to any of those areas of concern in the last 14 days, they will not be able to visit, and that includes the ACT. And everybody who is on site and remaining on site must wear a mask at all times. For our home visiting services, and we do a lot of home visiting services, we will move as much as we possibly can to virtual. However, there's quite a lot of nursing interventions where people need to attend to wound dressings and the like. Those will continue face-to-face. Your nurse will need to wear full PPE and we'll be negotiating with individual patients around that sort of care. So lots going on. Our staff are working diligently to keep you safe, and nearly every staff member you see has had their role or responsibility changed in some shape or form in the last 18 months. And in most cases, they're doing more. Also, over the weekend, we did lots of extra testing. So when we heard about the ACT, we immediately stood up testing clinics in those towns around the ACT. So Young, in particular, Tumut and Gundagai, and we tested over 400 people just over the weekend. Also here in Wagga, there's been a big increase in testing as well, with over 1,000 people tested over the weekend. So we can and will increase the testing clinics as required. There are 16 testing clinics across our region and 4 here in Wagga, and again, we can expand those as the demand increases.
So do you have plans to expand those? I know a lot of people have been struggling to get through to the MLHD hotline. They've been waiting 6 hours in queues on Friday was the time frame I heard of. Is there plans to actually do that, or are we going to wait and see how we go?
No, there are plans afoot. We'll be making some announcements soon about increased capacity for testing here in Wagga Wagga. And I do want to thank our staff in the COVID hotline who took over 2,800 calls in the last 5 days. And they are the people who can negotiate with people who are wondering about where to get a test or wondering where to get a vaccination. And they look at all of the options with GPs, pharmacies, private pathology testers as well as our own, so they kind of navigate the way for people. And we thank you for your patience, but yes, we definitely are planning additional testing.
I know this is not your clinic, but the numbers at the Lavity drive-through clinic did seem quite low yesterday after news of the lockdown came into effect. I guess, do you have any messaging around people still needing to go get tested if they have the slightest symptoms? That is a reasonable excuse under the lockdown orders.
Yeah, thank you. And it's very, very important that there's 2 things that we can do right now to keep our case numbers at 0. And we are in the most privileged and fortunate position. Early testing is one of the most critical things that people can do in addition to staying at home. So I'm just going to run through the symptoms again. So anybody at all who has a dry cough, a fever, a runny nose, a sore throat, or just feel very, very tired and unwell, absolutely should come in and be tested early. It's really, really important. That combined with the sewerage detection, which currently we're undertaking weekly, but if at any hint of community infection, we can increase that sewerage testing capability to more frequently. Yeah.
Are there any plans with testing clinics to create maybe a priority testing clinic for, say, essential workers who require a test every 2 to 3 days, or parents of young children who might be picking up daycare bugs all the time and can't wait 6 hours with a toddler in a queue? Are there plans for that, or are we going to keep this whole community-wide approach of one testing clinic for everyone sort of situation?
Yeah, and look, as the situation evolves, we've got a number of different models. So at the moment, we already have priority testing for our staff. They will get tested and their results back very, very quickly in 24 hours. And we tend to give them the early appointments so we can get them back at work if needed. But as the situation evolves, definitely should we get an infection, we'll make sure that we have testing capability for close contacts and people who've been in those areas of concern, separate to the general population. Yeah.
Now, correct me if I'm wrong, are you guys pausing elective surgery, or is that an ongoing pause that has been happening?
So here in the Murrumbidgee Local Health District, as we do not have any current COVID cases, we are continuing on with our elective surgery as we can do and as is scheduled. I think the biggest risk to all of the rural areas is workforce. So if we need to increase testing or other COVID-related response activities, that's when we may have to consider any kind of pausation of services. And it's mainly to pull the workforce into the COVID response.
And as you said, we do have no cases at the moment, and say if we continue to have no cases, how long do you think this lockdown should go for? Should it just be the week, or if it's extended, should we be included in an extension as well?
So all of the stay-at-home rules are determined by the New South Wales Government on advice from the Chief Health Officer in Sydney. So I will leave that decision-making to them, yes. And I have my colleague here, Inspector Noble, who's probably had a very, very busy weekend, I suspect, Bob, with the new stay-at-home and people stocking up on urgent groceries. Over to you.
Yeah, thank you. Thanks to Jill. And as we've heard from Jill, health changing the way they do some of their business, and a lot of people either fronting up for work or starting work at home this week today with the new health order are changing the way they do things too, and so we are too at the police district. And to that end, Operation Stay at Home commenced at midnight this morning. This is a compliance-focused operation. It will be very targeted around people who are not complying with the health order. We'll have a particular focus on people being away from home, particularly if they're out of their area, come from an area other than the Riverina, and they've come here when they have no rightful exemption or lawful excuse for doing so. And anyone detected doing that will be proceeded against to the full extent of the law. Because of the changing and worsening nature of the pandemic, particularly in regional New South Wales, our natural disposition towards leniency and discretion is likely to be somewhat watered down for a while. We really need the message to get through to people that compliance with the orders is critical if we're to diminish and slow down the spread of this virus in regional New South Wales. Obviously, Jill also has spoken about the importance to undertake vaccination and be tested if you've been into an exposure area or you may have symptoms. So that's also very important to the achievement of this overall mission, which is to reduce the spread of this virus as it is, but also fortify the population through vaccination to ensure that the survivability or the amount of effects that people feel is somewhat improved. Yes, it was a very busy weekend in terms of police enforcing what was the previous version of the health order and the new version that came in at 5 p.m. on Saturday. To that end, there were a number of other infringement notices issued against persons across the weekend. Some were for people being here when they shouldn't have been out of their own area. There were some for not wearing face masks. And there were other infringements too, and there were a number of other infringements also issued in relation to the party at the university that we've been speaking about. There have now been 22 persons issued with fines, with $1,000 fines in relation to that particular event, and I think that sends a very strong message that irresponsible behaviour such as that, as much as it wasn't intended to cause harm, can be very harmful, and there will be consequences. And those individuals are actually very lucky that the offence occurred before the fines were up to $5,000 for that sort of behaviour. So the fines are now extremely hefty. They will have a significant impact on anyone who is incurring such a fine, and we would encourage people obviously just to do the right thing. We will, over the coming week, Operation Stay at Home will run for at least a week at this stage in this area. We will be changing our taskings. We'll be making them more intrusive, more highly visible to the public, but we'll also have a number of covert undercover officers who will be in plain clothes patrolling areas. And because the stay-at-home order now applies to the whole of the state, there's nowhere to hide. So if you're here from another area and you're not meant to be here, you're going to stick out like a sore thumb. People are either going to inform on you to the police, or the police will detect you, and you're going to be lighter in the pocket and you're going to be sent home. But more importantly, you may be exposing yourself and others to serious risk of infection, and we know what can come from that. So that's where we're at with Stay at Home. We continue to run an emergency management response. As I said last week to you all, we're doing some planning around supporting health if infections do become an issue in the Riverina and across the Murrumbidgee. We've got another meeting of the Region Emergency Management Committee tomorrow to discuss some of those initiatives, of which health are a central player. So it's a whole of government approach. There are a lot of people in this space, and it includes local government, the federal government and the state government machinery. And at this stage it's going well, but we can't be complacent. We've got a lot of work to do to ensure that we can cope with anything that arises.
What areas are you focusing on? Well, when you say you've got plainclothes cops going around, or you're doing compliance checks, have you got any towns in the Riverina that are strong focuses, or have you got, like I said, the marketplace, or where are you actually focusing on?
Well, I mean, we'll have a broad focus if such an expression exists, but Wagga's the biggest population centre, and so that'll be our primary focus. There are a number of places where people like to gather in numbers, particularly indoors and outdoors too, but it won't be just Wagga. I mean, we're following up reports that came in at the weekend about people planning informal, unauthorised gatherings and parties and celebrations and what have you. We'll be following those up, and some of those are not in Wagga, they're in some of the smaller towns. So it's just basically people getting together in numbers is the critical risk. And that can include relatively small numbers. I mean, if you've got 8 people assembling at a house when they shouldn't be there, that's a significant risk. If one person obviously has the virus in that setting, you're then going to have 8, and then you'll probably have 88. So those are the kind of things we'll be looking at.
What are some of the challenges when it comes to policing this sort of issue in a regional area? Obviously, it's a very different operation compared to the metropolitan counterparts.
Well, there are a number of challenges. I mean, firstly, it's not something that generally most police officers think they're getting into at the start of a career, so it requires the police to think in a different way. It requires us explaining and marketing, and that's one of the reasons we're here today, is to talk about why we're doing it, because we need the public ostensibly to accept the reasons why we're doing it. We do to a certain extent, police by consent in this state. It's very important we have the moral authority that's granted to us by the public, so we don't want to come into it heavy-handed and just smash people with fines, but it's a different way of thinking about policing for us, and it's a different way for the community to think about their police behaving. So that's one of the difficulties, is changing the way people think. And once we get through this pandemic and we get people sufficiently vaccinated and we do what we need to do to, stamp the virus out as best we can, then perhaps we can all get back to thinking about a more traditional policing model. But police are like health in this instance. We've got to think differently. We've got to do our job differently. And change is always difficult, but the police are doing a great job in that respect.
What about the people? We have the rule that it's either in your LGA or 5 kilometres from your home. Obviously, that's not something that people in rural areas of the Riverina Police District can stick to. How are officers going to deal with that sort of situation?
Yeah, okay. So look, the health order is designed to achieve a couple of things. It's designed to stop people coming into contact with other people unnecessarily, to stop them from moving any further than they need to, and ending up in places where they could be infected or they could infect others. So the 5 kilometre stipulation is around that, but obviously, as you say, in rural areas, you might have to go 55 kilometres to get your nearest provisions and groceries and what have you. Providing you're travelling by the shortest practical route to get those things, and you're doing so in a planned fashion, and you're not doing anything ad-libbing along the way, you're not calling in to see friends or doing other things, you'll be fine. Okay, so the orders are meant to achieve certain things, and in my own instance, I'm 30 kilometres from groceries too. 5 kilometres wouldn't work for me and my family. But generally, if you stay in your LGA and you travel by the nearest practical route, you're not going to have a problem, because you're going to be doing what the order is designed to achieve, I should say.
You mentioned that there were some other fines issued apart from the ones relating to the CSU
Yep.
or the university gathering. Are you able to shed some light on what some of those incidents were?
One of them was a few people gathered at a house having a bit of a party, I suppose, and they were proceeded against. There was some other people not wearing face masks. There was another matter where a person was detected committing a range of other offences, and that person was put before the court, but also was charged with the breach of the public health order into the bargain. So they didn't receive a fine, they received a court attendance notice. So these are things that I expect we're going to see a bit of. But predominantly our focus is people going where they're not meant to go, and that means leaving home without an exemption or a necessary reason for doing so. If you don't have a valid and very important reason for leaving home, you should stay at home. The order is very, very simple. You should stay at home.
What pressure does this operation put on local police resources, knowing that, you are at times, you don't have your full complement of officers, and resourcing, like in many regional industries, is not at 100%?
Well, it's extra work, obviously, but by the same token, you've only got to look around town now, in any town, you see it's very quiet. So that's likely to have an impact on the level of our calls for service anyway. They're likely to be reduced a little bit, so we do free up a bit of capacity to do some of this other work, but we're also, we're pressing the police into action. They're working harder, and just like our friends in health and other industries, yes, we're working harder, and it's been a bit of a campaign, but it's what needs to be done to keep the community safe.
There are still several loopholes. For example, someone who can come from Greater Sydney to regional New South Wales, if they can genuinely prove they have an intent of buying a property out here to inspect that property. How do you prove genuine intention of moving someone to inspect a property? It's one of those sort of, I know they're doing that, they're kind of booking in vaccine appointments to come out here. How are police monitoring these loopholes that people are trying to outsmart the property?
Well, they're not so much a loophole, they're an exemption. It's just a matter of the people are applying that exemption in a sincere way. Police are very adroit at determining when people are telling lies. All police are investigators, and I think anyone who thinks they're just going to tell a few porkies to the police is going to get a rude shock, because there'll be follow-up question after follow-up question after follow-up question, and sooner or later those people run out of answers. But as I say, they're not loopholes, they're valid exemptions, but if you think you're just going to pretend that you're coming out here to buy a property or to do maintenance on something, or get a vaccination when you could have got one at any place, 50 places in between, you're going to find yourself probably $5,000 lighter in the pocket. Okay. Any questions for Jill? Okay, one for Jill or one for me? One for me.
Excuse me,
Just
I'm quizzed.
Just on the loophole section, Bob, do you think that the permit system coming in as of this Saturday is going to make it easier for officers when monitoring the situation, or is it still going to be much of the same?
Well, the most important thing is that it's made easier for the public. I mean, the public usually want to have something in their hot little hand to prove they're doing the right thing. So that's, if we can make it easier for the public to comply, they're more likely to comply, and that will help police officers because there'll be less people confused and concerned. So, I mean, it's a difficult situation for the legislators and the people that are putting together the health orders. They can't make an order that caters to every single situation and every single variance. So, anything that makes it clearer for all of the community to comply is a better thing for the police as well.
And there were also reports of police going around to businesses this morning, even shutting down places that maybe shouldn't have been open. Could you just talk us through what's happening?
Well, I mean, there may be some businesses that don't quite fully comprehend that they can't trade, can't be open to the public, at least in this situation. So we're going around making sure that any that are open that are in contravention of the order are aware of what they're doing. So if it's proven that they're just deliberately contravening the order, they are likely to receive some pretty big fines. But whenever something comes first in, you need to approach things with a little bit of a view of helping people to comply. I mean, ultimately, if you can help the community to comply, which is what I said earlier about easier to understand arrangements, that makes it a lot easier on everyone. You want to make compliance as unonerous as possible. That's pretty difficult at times. Health have got a very, very difficult balancing act to play in protecting the community, but also making the community still function. I think they've done a good job in the circumstances. I wouldn't trade jobs with them, but as I say, the important thing is making compliance as easy and as straightforward and as easy to understand as it can be made.
With those compliance checks, people are found to be not compliant. Is it a case of ignorance or perhaps not understanding the rules properly? What's sort of been the general reaction to somebody being found to be not compliant? Is it a case that they just don't understand the material that's been put out for the public to consume?
I think there are sometimes instances where people just don't understand or they haven't picked up on what's being said or the orders have changed. You can't continue to use that as an excuse, ongoing. But sometimes people are willfully ignorant as well, and that's not acceptable. Okay. You might have
Right,
yeah,
thank you.
done.
Let you go and get warm.
Thank you. Yes, cold, isn't it?
Oh, it's freezing.